Hello, I'm Sharon with Nurse Tim, and I'd like to thank you for joining us for our webinar, Item Analysis Made Easy, featuring Karen Sherrill. We will have technical assistance available at 866-861-2896, option 1, or help at nursetim.com. Handouts are available to download for our live viewers in your login email and for archive viewers on the right side of your screen. Please note, handouts are for personal use only and are not to be distributed to others. On the Zoom toolbar, you'll find the Q&A pod usable by our live attendees. At the end of our webinar, we look forward to a discussion with your questions in the Q&A pod. Our archive listeners are encouraged to drop us an email or give us a call. We also value your input as to desired topics for future webinars. ANCC disclosures. NCPD. This webinar has been awarded one Nursing Continuing Professional Development Contact Hour by Nurse Tim Incorporated. Nurse Tim Inc. is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. Successful completion. Criteria for judging successful completion of the webinar are attendance at the entire activity and submission of a completed evaluation. Expiration date. Archived activities must be completed and evaluations submitted within 30 days of accessing from the Nurse Tim Inc. website. For more information, contact help at nursetim.com. Learning outcomes. 1. Differentiate content validity from item analysis. 2. Discuss quick steps in applying statistical data to improving exams. 3. Apply principles of test review to a data set. Throughout this activity, the speaker may use a variety of real and varied resources from health education vendors. They are for illustrative purposes and are not to endorse any product. All images and references to the NCSBN Next Generation NCLEX are the property of the National Council State Boards of Nursing and provided for teaching purposes only. And now I'm so pleased to introduce our speaker. Karen Sherrill is an experienced nurse educator with over 3 decades of teaching in associate degree and baccalaureate nursing programs. Her experiences, passions, and areas of expertise are broad. They include clinical judgment integration, next-gen NCLEX item development, active and scrambled classrooms, student success and remediation, pre-licensure testing, and simulation pedagogy. Karen has led several innovative projects in college, statewide, and national organizations to advance teaching and learning in nursing education. Karen enjoys serving on the board of directors for Haiti Kids School, which supports children's education in Leogane, Haiti. In her retirement, she enjoys traveling internationally and getting out of the hot Phoenix weather and escaping to the mountains of Montana. We are so thrilled to have you with us today, Karen.
Thank you, Sharon, and thank you to everybody who is tuning in today and everyone who's listening via archive. I really hope that over the next hour, you're going to find some valuable information that you're going to be able to walk away with. You know, one of my goals in presenting webinars is to provide simplistic ways in which to make things happen. If things aren't simple, my brain just can't comprehend it. So I'm hoping through this process, if you feel like you struggle with how to analyze items, I'm hoping this process in the next hour will really make this much better for you and make your life much easier. So the ultimate goal is, of course, making a perfect test. And I can remember, very clearly remember when I started in academia, and it has been a lifetime ago that I started writing test items and putting exams together for students. I truly thought that I would be able to achieve a perfect exam. I thought that if I worked hard enough and I perfected each of my questions, I would have beautiful analytics and I would have just something just shy of the National Council's NCLEX exam. I was convinced of that. But what I have learned over time is that there are so many different changing factors that impact our performance of an exam, is that although we strive to achieve a perfect exam, it truly is near impossible as an educator in the classroom to be able to invent that. But what we are going to do is learn ways that we can continue on an upward trajectory towards that perfect exam. So as we look at analytics, there really are two different approaches. And I'm sure that statistical analysis is probably something that you have learned a lot about in the past, heard about in the past, and probably is the more predominant way that we like to look at test items. But truly, one thing that we can do that's easier is what we call content validity. And having these two different approaches to analyzing our items is really what is going to perform and create that exceptional item that performs consistently really well. So when you look at content validity, it really is based upon two different factors. We gain content validity from having our colleagues look at our test items, giving us feedback, saying, you know, I really don't understand this portion of it, or this is a little confusing for me, so it's probably confusing for students. Or having them review an exam and say, you know, these questions are much harder than what they should be for this level of student. Those are the pieces of content validity that we need to take into consideration as we are adjusting and rewriting our test questions. The way that we more commonly get content validity is through student test review. And I can tell you many times in my career, I've had students who are reviewing their test and point out to me something, and you look at it and you go, oh my gosh, I just really didn't see that error before, or I didn't see that incorrectly spelled word, or I didn't see that my numbering was skewed. I didn't see those things. Students perform poorly on a test item, not because of something analytically that went wrong, but the analytics went wrong because of an error within the test question. Statistically, of course, we look at item difficulty and we look at item discrimination. Those are the main concepts of our statistical analysis, as well as looking at our exam as a whole. Knowing that content validity does not evaluate statistical analysis does not evaluate content validity. We may have poor statistics because of poor content validity, and poor content validity is going to create problems in our, these two are cyclical, they're both important, they have equal levels of importance. So it's important for us to use these two different factors when analyzing our exam. The other thing that this process does is it takes some of those emotional decisions away from our test items. We get really vested in our test items. We have some items that we love, and you know, I have one I can think of that I have used and rewritten probably 15 different times, and I cannot get the question to perform well. But I love the question. So what I've opted to do instead is to pull it out of testing where it performs poorly, and I either have to make accommodations for that item, or I have to explain to students why it is they didn't choose the best answer. But I pulled that item out, and now I put it into my classroom, and I use it as a learning opportunity for students. So I still have the emotion of being attached to it and sharing it with my students, but students are not going to pass or fail based upon that one poor question that is not performing well. And using these two approaches also builds a much stronger test. It's fair to all students. And there's no reason why your exams cannot be hard, but what is more important is that they're fair. And I've found over the years when I ask student feedback, okay, tell me what you think of my exams. They say they're hard, but they're fair. And students can live with that. What they can't live with is an exam that is hard and unfair. That is unethical for us as educators to be putting that forward to our students. So, like I mentioned, content validity, look for typos, look for unfamiliar terms, look for item bias, look for does one response to an item, is it found in another response? And that can create some confusion in the test takers. Is there clearly one best response, or are there a couple of options that truly are both correct? And what do testers say about that item? When we look at item analysis, we think about the cognitive level of Bloom's. Is this a low-level item? Is this a high-level item? We look at each of the discriminators to see if they're performing well. We want to recognize how difficult is this test item, what's its level of difficulty, and what is the overall performance of the exam. So very different steps in the analysis process. So let's have our first polling question today. And I want to ask you, how do you best assess the content validity of your questions? You've got 4 different answer choices here. If you are watching us live, then feel free to go ahead and participate in the poll. If you are watching via archive, I want you to reflect on this question and identify where it is that you would fall in choosing one of these answers. So how do you best assess the content validity of your question? You might have more than one answer here, but only select one. And Sharon, once you see that poll, you can, thank you, close it out. Okay, so majority of you are saying you get feedback from students and peers. Second highest level is reviewing it yourself. Okay, so know that content validity is best measured by gathering feedback from as many sources as you can. When you are reviewing an exam yourself, many times it's challenging to be able to see the errors within it. And so I encourage you to reach out to your colleagues, reach out when you're doing student reviews, allow students to give some feedback on questions so that you can find a way in which to best meet the needs of content validity. So when we look at some national survey data, and when you're looking at the process of testing exam creation practices, there have not been a lot of studies based upon this information. There is not a lot of evidence-based practice related to exams in the United States and teacher-made exams. So one of the studies that was done in 2017, in fact, Dr. Wangerin and Dr. Bristol and myself put together a huge survey, and we sent that out to faculty across the nation that are providing pre-licensure exams and gathered lots of information to find out what practices are being used. And it was very shocking to us to recognize the inconsistencies. In fact, the irony, Dr. Nelson, who was a part of our team and our statistician, said the best theory that describes what you have here with these 600 to 700 participants in testing practices, he said, I'd best describe this as chaos theory, because there really is no consistent rhyme or reason as to how nursing schools are providing exams to students. There have been a couple of surveys done since that time that are on a little bit smaller scale than this one that was done in 2017, but the needle has not really budged a whole lot in many areas. So for example, one piece of information from the survey was looking at the process of content validity, and the survey showed that less than 34% of the respondents used any type of content validity when evaluating their exams. And maybe that was a part of they didn't understand what content validity was, or maybe it was actually for many of them that they don't have a process for that. So I find that very alarming. And so one of the best first steps you can take to improve your test items in your exams is to make sure somebody is looking through them for content validity, making sure that that information is being presented in a consistent, non-biased, error-free way. So what else have we found? Like I said, since that time, the more recent study that I've seen, several studies, and the more recent one, which actually was published just a few months ago, shows that as much as 50% of multiple choice items are flawed and failed to provide discrimination between high and low performing students. 50%, isn't that astounding? To recognize that we have done studies looking at flawed items, and there's a significant amount of errors out there. And the part that frightens me the most is identifying the fact that these flawed items are many times reasons why students are failing in the nursing program. Faculty may or may not give the student benefit of the doubt in test items, and students are not progressing as a result of these flawed items that are out there. So let me give you an example. of how we would evaluate content validity. In this particular question, a client's returning from the recovery room following abdominal surgery. Upon the client's arrival to the surgical unit, which parameter would be the initial focus of the nurse's assessment. Okay, so the first question I have for you is, does the item make sense? So reflect and think about, and you may have to reread the question, this item makes sense. Well, as I look at this, I think, okay, not really. It's not clearly written. We've got a patient moving from the recovery room and going to the surgical unit. And really what I'm wanting to know is, what's the nurse going to do once they get to the bed on the floor? You want to ask yourself, are there any typos or unfamiliar terms? Okay, parameter, could that be a confusing term to some students? Possibly. Is the content appropriate? And appropriate means, is it level to my student group? Does it is it connected to one of my student learning outcomes or one of my course objectives? And is the response to one item found in another? Well, I've got pulse oximetry reading, vital signs, pain in the incision, status of the dressing, and I might have a student say, well, you know what, vital signs include the pulse ox, therefore, is the answer 1 or is it 2? Is it 2 or is it 1? So that could have some ill effect and poor outcomes for this test item because 2 answers contain the same material. And then, of course, is there clearly one best response? Well, I would have to say probably not. You know, many schools teach students that pain is a part of the vital signs. Therefore, I could look at answer 3 as a possibility of fitting into answer 2 as well. So you're going to see students respond to this question in different ways, depending on how they're analyzing and looking at that. So here's another one. Nurse decides to administer tablets of acetaminophen instead of intramuscular meperidine. She's been given to one of her orthopedic patients. Why would she do this? Okay. Question again, does the item make sense? Is there anything confusing to it? Are there typos or unfamiliar terms? Is the content appropriate? Is the response to one item found in another? Is there one best response? I'm going to give you a second to reflect on this because I want you to read it and really think deeply about how you would validate this question for validity. So as you're looking at it, there are some things here that I find a little distracting as I read it. The fact that the question is calling the nurse a she, that has some bias to it. The fact that the answer choice number 4 is calling the patient a he, and it's written in a different format from the other answer choices. If you were in our session earlier on test item writing, you would recognize that client is the correct response to what we're calling our patients now, according to National Council. So that would require some editing there as well. So as you look at this, you're thinking, okay, what is the question really asking? And how do I need to reword that in order to make it sound more clear and defined for a student? So our last one, nurse determines that an elderly patient is experiencing orthostatic hypotension. After assessing the blood pressure while the patient is supine, the next nursing intervention to promote patient safety for ambulation will be ? So as you read this question, again, is it clear? Is there conflicting information? Is there an answer choice that is correct that there is the same information in another answer option? Analyze the question, think about how it should be reworded. And I will be honest with you, these test items came from teacher-made exams. They're not something I invented for this example. These have actually counted towards and against student scores in classrooms. And you can see as you really think deeply about this question that it's got several different layers of flaws in it. I know the first time that I had the courage to take one of my teacher-made exams and share it with one of my colleagues, that was a scary thing to do. And it's kind of like going outside naked in a crowd. You just really feel like you're exposing yourself. So what I opted to do is choose one of my colleagues that I was close to and I had a friendship with, someone who had similar content knowledge, but I could really trust them. And we had a discussion how we wanted to improve our test item writing skills. And so we decided to exchange exams and give feedback. Hearing her examples of ways to improve the test catapulted my ability to be more confident in my test item writing. I suddenly was able to see things through her eyes that really justified what I've been hearing from students in exam reviews. You know, as a new educator, I got pretty defensive about my tests, and I felt like I had to argue students for what's right and what's wrong in order to prove to them that I was adequate of that position. But once I was able to let down my guard and share this with a colleague, get some feedback, I was really looking at things more objectively and not taking it personally when there were errors within my exam. And it allowed me to grow significantly through this process. So I encourage you to do the same. So what I want you to do is to pull out a piece of pen and paper, or sit back in your chair, take a sip of your water, your coffee, or your soda, or your wine, whatever you're drinking today. And I want you to pause and reflect. And I want you to think about 3 ways that you can improve content validity when writing your exam. Now, if you're watching live, take a second to do that. If you're watching via archive, again, I want you to participate. Think about 3 ways, 3 specific things you can do to improve content validity when writing your exams. And I'm going to give you a solid minute to do that. So go ahead and take the time. So while you were reflecting, I ran and refreshed my drink. I went to the bathroom. I grabbed a little bit of lunch, but we're all back now. Okay, we're all back. So I would love it if we were in a live audience together, because I would get some of your feedback right now to learn ways in which you are making a difference and how you're going to change things in the future. Oh, Sharon, thank you. Sharon just chatted to me. Great idea. You can go ahead and put your ideas into the Q&A. I would love to see some of your ideas and reflections of ways you can improve content validity. So thank you, Sharon, for adding that level of interaction for me. So if you come up with some beautiful ideas, I'd love to have you share those in the Q&A. And things are rolling in now. I love it. Review the exam at different times. Perfect. You know, if you sit down and you write a test and you try to perfect the test all in a single setting, it's not going to happen for you. They've got to marinate. You've got to just kind of sit and reflect on those exam items before you come back to them the next time, and a few days later, and a few days later. Take some time to see those kind of errors. Liz is putting, have students provide narrative insight about things that confuse them when time permits. Absolutely. And what we should do from this student narrative insight is we should in fact be making adjustments so that we're not reliving those same errors semester after semester. Amanda says to continue, where'd you go? Continue having peers review, continue student reviews 1 week after the exam. Absolutely. And you know, one other comment to that too, Amanda, when you're looking at exam review, I think oftentimes students expect exam review to happen immediately after the test. They want to know exactly what they got wrong, and they want to have that information immediately. The challenge you have, as soon as you start giving the students the correct answers and provide them with that, they've stopped thinking about the question. You know, I made a habit that no exam review was provided for a week. And so students would see their scores, but they would not have exam review for at least a week. And what happened during that week is that they took the time to research. If they were unclear on a question, they researched it, they reread it, they remediated themselves before they even came to me because it was haunting them. Now, if I told them the rationale during a review immediately after the exam, they would, to shut their brains off, they never would have thought about it again. So deeper learning takes place with reflection. So you've got to allow your students time to reflect. Excellent. So I appreciate all your input. There's lots of great ideas coming through here now, but I'm going to have to move on with the presentation. I do encourage you, again, questions at the end. I'm going to save some time for that. So polling question number 2, how do you feel comfort-wise with the process of item analysis? Not the content validity like what we've been talking about, but let's think about item analysis. Where is your comfort zone? And you've got 4 different answer options. If you're watching this by archive, then reflect on the choices, see where you would fall within this different variety of questions, 4 questions or answer choices here, I should say. How comfortable do you feel with the process of item analysis? Okay, Sharon, when it's ready. Wow, that's a pretty even split. We are pretty consistent. Wide range of item analysis. 31% are, I've got it. Most of the time, and the lowest, or I should say the least comfortable is, that's why I'm here, because I'm not comfortable, and that's 26% of our audience. So we really have kind of a consistently split group when it comes to item analysis. So let's take a look at that process. And again, I refer back to that national study from 2017. I wish that we could repeat this study, but of course we have not been able to do it yet. I know it's somewhat dated, but unfortunately it's about all we have out there. But when we look at what best describes the nurse's confidence in analyzing an exam, this is the percentiles that we came up with from this survey of faculty educators across the nation. And there was about 1.1% that had nearly no, but they had less than 1% that, or, you know, right at 1% that had no confidence in their ability to analyze an exam. Most people were moderately confident, but only 20% were highly confident. And of course, in these schools, I would have to be asking the question is, what kind of support do you have in analyzing your exams? You know, I'd want to know, okay, are your highly confident people assisting your folks that have no confidence or limited confidence in their process and their ability to analyze exams? So think about your own campus and the folks that do have great abilities and understanding of analyzing exams. And if you're not sure of yourself, seek them out. See if you can find someone that will help guide and teach you through this process. So when we look at statistical analysis, we're going to examine the test questions themselves as well as the student answers. And the purpose of this process is to assess how individual test items contribute to the overall reliability of the exam. I think many times we think, okay, I want my statistics on my exam, but what you're going to hone in more so is statistics on your individual items. So when we look at the exam as a whole, you're going to look at various levels of difficulty, your mean, median, and mode, and that basically tells you what your middle score is. And they're measured a little bit differently, but it's kind of like, okay, what was the average score? And when I look at that information, I'm like, oh, nice to know, not necessarily needs to know, okay? I can't do a lot about mean, median, and mode. I may track that from one semester to the next to tell me how a student comparison of this exam, if it's the same exam, in one semester, maybe how it performs in my fall cohort versus how it performs in my spring cohort. And it might start to tell me what cohorts are higher and lower performing overall, but it's not anything I do a lot about when I'm analyzing. It's, like I said, it's a nice to know piece of information. I can also look at my exam reliability, and most features of exam testing products will give you a KR20, and that is going to show me the consistency of the exam. And what that means is If I gave this exact exam to another group of comparable students, the exam, how well would the exam perform? Would it perform the same, or would it have completely different outcomes? So when you're looking at that exam reliability and the KR score, the higher is better. The higher your KR is, the more likelihood that you will get the same outcome if you repeat that test. Again, as a teacher-made exam, I can't necessarily improve my KR score other than improve my individual items. So we'll talk about that more here in just a second. So the KR range is a 0 to a +1. So if we have a KR of 1, that means there's perfect reliability. Well, I'll tell you right now, National Council of State Boards of Nursing only touts about a 0.95, around a 0.95 reliability. So that exam does not have perfect reliability. Given that information, do not expect your exams to have perfect reliability. It really is not possible. But what we can compare is, what do these different parameters mean? So if we look at our reliability coefficient and you look at the different percentiles, basically, or you know, the decimals that you've got there, if we have an exam that falls below a 0.70, it has a limited likelihood that it's going to replicate and be reliable if you replicated it with a different group. So this can be somewhat discouraging, because it wouldn't surprise me, if you are tracking your KRs, that oftentimes you might get things like a 0.5 or a 0.6, and you're thinking, this is a horrible exam. But the fact is, it's not a horrible exam. There's so many parameters that come into play that impact that number that you should not place the value of the exam on your KR. What you can do is think about ways to improve the KR. And there are factors that come into play, and probably one of the best factors is you have to look at how many test takers do you have. If you are giving that test to a group of 30 students in the cohort, your KR is going to be completely unreliable. You can't trust it. Even if you're giving that to a group of 80 students, your KR may not be reliable. So when I look at a KR, again, I think about nice to know information, but it's not going to make a difference in what I do with this test moving forward. The information that is far more valuable to me as an educator is looking at the item difficulty and the item discrimination. So an item difficulty is the percent of students that get the item correct. It's also known as your p-value. And what's considered a good p-value is a 0.3 to a 0.8. Ideal, 0.7 to a 0.8. So somewhere around that range for your high of a 0.7 to a 0.8 is acceptable. And your anticipated p-values for your campus and your analytics and what you're sharing and using in your campus should be a part of your testing policy with your faculty, where we have agreed that this is the p-value difficulty range that we're looking for. So what does that mean? If I have a very low p-value of a 0.3 or below, that tells me that a lot of students miss that test item. That means that less than 30% of my students got that item correct. Now, if I have a p-value of a 0.8 or higher, that means that most of my students got that item correct. Okay, so what it's identifying for me is the difficulty of the exam item. So if 80% or a 0.8 p-value, that shows that 80% of my students got that item correct, that means that that was a relatively easy test item. If I have a p-value of 0.9, that was a very easy test item. Now, if I have a p-value of a 0.25, that means that very few of my students got it correct, and that item was very difficult. Know that a difficult item does not mean that it's a bad item. What we need to do is we need to think about the discrimination of who it is that's getting that item correct and who it is that's getting the item incorrect. So when we look at item discrimination, we have to look at our point by serial. You'll see it referenced as a PBI or a PBCC, minor variations in what those terms mean, but it's basically, you can look at it for the same component, and that's your item discrimination. So your point by serial has to do with, are your high-performing students getting the item right or wrong versus your low-performing students getting the item right or wrong. And this is a better way to identify and discriminate between a good and a bad test item. So what do we do with that point by serial? We want to first look at, is the point by serial positive or negative? When a point by serial is positive, that means our high-performing students are selecting that answer. If a point by serial is negative, that means our low-performing students are selecting that answer. And as a general rule of thumb, if an item point by serial is less than a 0.15, the item should be revised, because that tells us that our lower performing students are getting the item correct and our higher performing students are not getting it correct. Okay. A lot of information on this slide that we just went through. So let's go ahead and go through some examples. I'm quickly opening up my Q&A. Okay, perfect. You guys are starting to put questions in there. Thank you. So let's go ahead and do some practical application here. I've just given an exam and I've gotten my exam analytics back. Of course, I've checked my question for content validity before I gave my test, because I went ahead and had some of my colleagues go ahead and take a look at it and give me some feedback. I tweaked and adjusted. I made some editing errors. I eliminated some bias that I found in a couple of questions. But now I've delivered my exam and I'm ready to explore my analytics today. The first thing I look at is the exam as a whole. And there were 45 possible points. There were 65 students that took the exam. There is my mean median that tells me what basically my average score was. Okay, nice to know. Okay. High score, 93%, low score, 53%. So I've got a pretty good range there. It looks good. There's not anything all telling here. Now, what would be some red flags that I could see in this? If I saw from my exam that my high score was 100%, and if maybe more than one student got 100%, I would have to think, is this a really easy exam, or is my exam then compromised? If my median or my mean score is high, say 85%, 90%, 95%, I would have to say the majority of my class performed very well on this test. And as an educator, that concerns me, because my exam is too easy, or once again, my exam has been compromised. If you're using the same item in the same exam semester after semester, or if you're using them and when your colleague teaching another cohort is using the same test, you could find that kind of information in your analytics that you have students that are cheating. So this is always why I analyze first the exam as a whole, because it can give me some clues into some poor behavior that might be happening behind the scenes. Next, as I look at my analytics, and I'm going to tell you this example I've given you today, I pulled this from a Canvas platform. And the reason I chose that is because it seems that more students or more programs are using Canvas. The thing with Canvas analytics in your testing platform is that if you look at just the superficial page that they give you that has lots of charts and circles and colors, it's beautiful, you don't get the detailed analytics. What you need to do is download the spreadsheet, the Excel spreadsheet of your exam, and it will look more like this, except it won't have these titles on it. These titles are something that I have added so that you know what these different components are. If you find that you want, I have a sample that has these titles on it with a full Canvas analytics. If you want that, just reach out to Karen and just reach out to our help at nursesync.com, and I will send it to you so you have that detailed for the Canvas analytics. But as we're looking at our test, first thing we want to think about is our difficulty level. Difficulty is the percentage of students that got it correct. And with this particular question, for question number 1, it has a 0.55, and remember we wanted that to be between a 0.3 and a 0.8, so it falls in there perfectly. My second question has difficulty level of 1, which means every single student got that question correct. If I go down to the very last question, 68% of my students got it correct, okay? So that's what difficulty says to me. And again, I want it from a 0.3 to a 0.8-ish is what I'm looking for. Next, I'm going to take a look at that point by serial. And that point by serial, I need to examine any question less than a 0.15-ish. I give these numbers very fluid because your individual campus may have different parameters, and there's not necessarily best practice standards. There's lots of options. So I'm giving you kind of the average recommendations that come out of the literature that's published. And that is below a 0.15. So if I had to look at my point by serial, this discriminates between high performing and low performing students. So question number 1 is a 0.40. That's very positive. That tells me that my high performing students got this item correct. The second one is a 0. And the reason I have a 0 point by serial is because every student in my class got this question correct. Therefore, the point by serial, there is no discrimination between high and low performers because everybody got it correct. Number 3 is a question I'd really want to look at because my point by serial is 0.08, and that means that low performing students got this correct, very comparable to my high performing students. That means that this particular question does not have good discrimination between those high and low performers, so I need to break into more detail as to what to do with this test item. Next thing I'm going to do to strengthen this test item is I want to fix my non-distractors. So what we see here is all the places where I had an answer choice that nobody selected. So my point by serial of distractor number 2, you can see that for questions 2, 3, 4, 5, and 6, nobody chose distractor number 2. That's a problem. That's a lazy distractor. That was not a plausible answer. That's where students checked into this question and said, oh, that's not it, crossed it out right away. So I need to go in and I need to check those. I need to rewrite those distractors so it's highly likelihood that somebody is going to be selecting those. Now what I want to do is I need to look at those poor performing items and I need to think about rewriting them. So I'm going to take a look at my difficulty index. I'm going to look at my point by serial. I'm going to look at my lazy distractors, and I'm going to think about how I'm going to rewrite those items. Now, keeping in mind that, okay, do I have an adequate sample size? I've got 65 students that took the test. Do I have enough questions in the exam? I had 45 possible points. So that justifies that these analytics are fairly reliable. If I have a small number of students or a small number of items, then these analytics are not as reliable. And I might not make huge changes on them because I can't necessarily trust the data that I have in front of me. So example 1, I'm looking first at my difficulty level. Answer number 4 was the correct one. 55% of my students got it correct. There were 52 students that took this particular exam. Somebody selected each of the 4 options. That's a great thing because I don't have any lazy distractors. So I'm thinking, yeah, 55, I want that to be a 0.3 to a 0.8. That's pretty good. I'm impressed. I like my level of difficulty for this item. Now I look at that point by serial and I see that the point by serial for the correct answer, number 4, is positive. That's what I want. And I see that my distractors, which are the incorrect answers, were selected by low-performing students. Again, I know that because it's a negative number. So this, to me, looks like a question that does not need any work. It's got adequate difficulty. It's got adequate discrimination. I've got adequate number of test takers. I'm thinking I'm good. I'm going to leave this question. I'm going to move on to the next one. So the next question I come upon The correct answer is number 1. 35% of my students got it correct. And of course, that's closer to that 30 to 80%, but it could be this is just a more difficult question. But I want to take a look at my point by serial because that tells me 35% of my class got it right, but the strong students got it right. And that's exactly what I want. I want my good students to get the hard questions correct. Therefore, this is a great question. It's a difficult item, but it's got good discrimination, which is what I want. Now, I also need to consider there were only 20 people taking this exam. So can I trust these analytics? Maybe so, maybe not. I want to continue to monitor this question each time that it's run because it might need some tweaking and adjusting at a later point. So take a look at this one and see if you can figure out what happened. We've got 75% of our students got it correct. And we can see from the point by serial, those are the stronger students because it's positive. We can see that our low performing students liked answer choice number 3 because it's got a negative point by serial. But nobody chose item 2, nobody chose item number 4. So I would want to look at those distractors and I wanted to make them more plausible so that somebody bites on them. You want to have somebody bite on all 4 of your answer choices. That would then improve the outcome of this item, and that would improve your overall KR score in the analytics of your exam. Another example, 65% of our class chose the correct answer, so it falls within our difficulty range of 0.3 to 0.8. But if we look at our point by serial, we see that it was our low performing students that got it correct. So we really want to take a look at, oh my, what happened here? What went wrong? Now, if I look at option number 1, my high performing students chose option number 1. I'd really want to analyze those distractors and say, what is it that made them make that decision? How should I adjust or change this? And consider how I'd handle it differently if there were 72 students taking versus 12 students taking this. I would be different in the way in which I'd analyze that question. Sorry, I opened my Q&A quick to make sure I wasn't missing anything. So what else do we want to consider? Again, distractors, make all of them plausible. Have at least one student should select every distractor. It's better if you can get more than one, but if you can even get one student on each distractor, that's a good day. Consider the number of test takers. Consider the history of a specific item over time. Is this the first time I've run this item? Have I used it for several semesters? Could this test item be compromised? Could this test item have made it into Quizlet or some other online program? Has it become compromised? Consider the variables impacting the current testers. And should anyone ever choose 100% ever? Well, if your class gets 100% on a test item, that means that it's either too easy or it's been compromised. Now, we're going to talk in a second about mastery level items, which are different. But if you've got items that have 100%, everybody's getting them right. Students love these questions, don't they? But it is not desirable in academia because it lacks grade differentiation. Now, in practice, do we want 100%? Yes, because it demonstrates competency. But on a teacher-made exam, 100% should not ever happen. You need to make those exams more difficult, those exam items more difficult, which brings us to the mastery level. Now, there is a difference between getting 100% perfect score on a test item and a mastery item. The difference is that a mastery item is one that you are planning to get 100% on before you give the test. So for example, if I have a test item that requires students to wash their hands is the correct answer, I expect every person in my class to get that one right. Hands down, it's got to come in at 100% perfect because I am planning that as a mastery level item. Now, what I cannot do is see my analytics after the test and say, oh, gee, item number 5, everybody got correct, therefore it must have been a mastery exam. item. No, that's not how it works. Mastery item is pre-planned. It is not post-planned. So what do I do if those stats are bad? You need to think about how you're going to handle them. I encourage you to have a program-wide policy on how you're going to handle bad questions. You need to have consistency in the program or you're going to have student grievances. So my first option would be if I've got a bad answer choice, I could give credit for more than one answer. And this is actually the preferred action. So what would happen if I gave credit for A is the correct answer, B, I can see how some students chose that. Okay, probably missed some content validity and that one slid through. Therefore, everybody's going to get credit for A or B, but they will not get credit for C and D. In that case, many student scores are going to rise. Not everybody, but many of them will. The second option that some schools use is nullifying the test item, and they give everybody credit for that one question. So rather than just giving scores to those that answered A or B, they will give everybody credit for that question and give them a point back for it. So what happens in this case is that your low performing student scores are going to go up, your high performing student scores are going to stay the same. Now, option 3 is if we delete the test item from the exam and recalculate the exam with one less item. So that would mean that I've got a 50 question test, but 2 items performed really poorly. Therefore, I'm going to make this a 48 question test rather than a 50 question test. When I make that decision, what's going to happen is that your low performing student scores are going to increase, your high performing student scores are going to drop. So be aware of that because you could have some unhappy students as a result of those choices. So let's put it all together. Client's vital signs are, you've got a high temperature, normal heart rate, normal respiratory rate, blood pressure is there. What actions should the nurse take? So I'm going to give you the analytics on that question. I want you to think about content validity, and I want you to think of the analytics. What concerns do we see? And go ahead and chat into the Q&A. I want you to see from you what kind of things jump out as being good or bad about this test item. I'm seeing other questions come in, nothing specific to this test item. Let me go ahead for the sake of time because I do want to have time for your questions. One of the flaws in this particular question is actually a typo. So if you look at answer choice number 1, ask the patient if he has had a lot to drink in the last few minutes. That should have read a hot drink in the last few minutes, and it was a typo. That's part of the reason why more of our students chose 4, which the author of this question identified is the incorrect answer. They saw number 1 as the correct answer. And you saw that our high performing students chose the correct answer. Our more students chose the incorrect answer, option number 4. So this is a question that actually has flaws of content validity, and that was that typo that needed to be corrected in order for it to have better performance. So here's another one. Client had an EGD for esophageal varices. And what findings should the nurse report to the healthcare provider? And I'll show you the analytics on this one. 35% of our students got it correct, and those were our higher performing students. 50% of our students selected number 2 is the correct answer choice. Nobody selected number 4. And again, this is a question that falls back to content validity because if you look at answer choice number 3, hypotension and tachycardia, portions of that are also in answer choice number 1, blood pressure and pulse. So you can see tachycardia falls into both 1 and 3, which is likely part of what caused the confusion within the students for this particular question. So how do we improve our reliability? It's going to increase with more testers, more items, more variability with item performance, fewer content areas, and consistent testing environments. What will decrease your reliability? Fewer testers, fewer items, easier items, more content topics, and distracting testing environments. So think about these things you can do in order to improve your exam reliability as you're testing. So I want to highlight to you the other 3 webinars we have in our series today. If you're watching these all live today, we look forward. This is our 3rd of the 4th that we're presenting. And we'll start the Next Gen Cases Made Easy shortly. But if you're on archive, I encourage you to go back, or if you missed the 2 live versions earlier today, these are some other opportunities for you to catch up on these topics and become the testing expert on your campus, which we all want to be. So now I will open it up to Q&A, and I see that the Q&A is blowing up. So I see Teresa, Dr. Teresa says, how do we get an Excel sheet with the Canvas analytic heading? You're simply going to send an email to help@nursesync.com and just say Karen's testing Excel. And they will send it to me and I will send it to you. Kristen, this question is regarding mastery items. Won't instructors vary on mastery items? I think it is mastery may not be what another thinks is mastery. So the secret to the mastery items is they have to be predetermined before the exam is given to students. What I encourage within your testing policy is to have a maximum number of mastery items each semester. A mastery should never be more than 5% of your exam, ever, because if not, you're giving your test away. Your students are going to be passing and they don't necessarily use that information well. So a mastery item needs to know content. So could it be different from one instructor to the next? Absolutely. If I have a mastery of a fundamentals class, then my mastery components are going to be based upon asepsis, it's going to be based upon safety, and those are going to be the components. If I'm teaching a final semester critical care class or leadership class, I'm going to have a different set of mastery expectations for that group of students. So it very well could be different. You just need to establish what is mastery before you give your test. Andy is saying, are there other programs that don't allow questions to be dropped, reducing available points? I'm assuming that you're referencing, Andy, like the software program, possibly. I guess I'm not completely clear on what you're asking. You know, certainly depending on your testing software, that will determine how it is that you can give credit back or eliminate items or have those processes in place. So work with your faculty, work with your technology experts, determine how it is best. If you're quizzing online, how is it that you make corrections in test items if there are in fact items that you want to give a partial credit back for or accept 2 answers rather than 1, that sort of thing. So talk to your software folks for that. And Deborah's saying, can you give the email for the Excel again? Yes, help@nursesync. And that they will get you what you need, or they'll get the information to me and I'll send it to you. So help@nursesync.com is where you want to send those requests. And like I said, I've just downloaded Canvas and eliminated their very confusing headers with terminology that's consistent with this webinar that I just presented to you. So if there's any other questions, I'm not seeing any more come in, so I will go ahead and turn this over to Sharon. Thank you for spending the time today. Appreciate it. Take care.
Thank you so much, Karen. And again, if anyone has questions, just drop us an email, or you can also add questions, give your feedback in the evaluation. And the evaluation will also produce your contact hour certificate. So right now, we invite everyone to submit that evaluation. Our live viewers are going to see a new screen appear in just one moment. please click the Continue button, and that will bring you to the short survey evaluation that will produce your certificate. And for all of our archive viewers, please just click that link on the right side of your screen. So thank you to everyone for joining us today. Bye for now.